Good afternoon and welcome to Ask Dr. Chris. Today we will be talking about surgical weight loss. We talked about intragastric balloons and non-surgical weight loss technique last week. Today we'll be talking about operations and what kind of operations we do, what we offer, and so on and so forth. One thing that we need to know about operations in general when it comes to weight loss is they are by far the most efficient way of losing weight. Number two, the result is sustainable for a long period of time. So if your interest is in a sustainable and efficient way of losing weight, this is the talk for you. There are very few operations that are designed for weight loss. Let's talk about them one by one. A procedure which is a semi-operation that is new on the market is the endosleeve. A well-established weight loss procedure is the gastric bypass. The most efficient weight loss operation is called the duodenal switch. In between the endosleeve and the duodenal switch, there are two other procedures. One is the laparoscopic gastric band or the lap band. Another one is a laparoscopic sleeve gastrectomy. All of these operations are unique in the sense that they provide sustained and efficient weight loss in a very short period of time. So let's spend a few minutes talking about the laparoscopic gastric band. The laparoscopic gastric band is an operation that involves putting a belt around the upper part of the stomach, creating a double stomach, a small upper stomach, and a larger lower stomach. Subsequently, when we eat, the food stays in the small stomach longer, makes us feel full for a long period of time, and it results in us eating less at each meal. It is a very efficient tool. It is also one of the safest operations for weight loss. The recovery is about 5 days to 10 days. It's done on an outpatient basis and is covered by most insurance. We expect some discomfort from the incisions that usually goes away within a couple of weeks. And despite all the reviews about laparoscopic gastric band, it is an efficient and safe way for losing weight. It's just like any other tool for weight loss. It needs to be used properly. The next operation I would like to talk about is the laparoscopic sleeve gastrectomy. Essentially, all of these operations share the same incisions, the same anesthesia type, which is general anesthesia. The difference is with the laparoscopic sleeve gastrectomy, it involves removing 2/3 of the stomach and creating a tube-like stomach, which makes us feel full quicker. We also experience the benefit of a reduced appetite, and it leads to significant weight loss in a short period of time. The pain is expected for 2 days to 5 days after the procedure and is manageable with medications. The recovery is about 5 to 10 days, and it's a very safe technique. The next operation I would like to talk about is the laparoscopic gastric bypass, which is considered to be the gold standard for managing obesity. The laparoscopic gastric bypass is different in the sense that we carve out a small stomach pouch, usually about 3 to 5 ounces in size, and then we bring a loop of small bowel and connect it to this stomach pouch, creating what we call an absorption reduction. Now, unlike the laparoscopic gastric sleeve, which only reduces the volume of the stomach, the gastric bypass combines reduction or restriction of the stomach with reducing the absorption. So you fight obesity in two ways. You eat less, but you also absorb less of the food that you eat, resulting in very, very strong and effective weight loss. Because it's a slightly more complicated procedure, it takes a little bit longer, but the recovery is very similar to the laparoscopic gastric sleeve. It's about 5 days to 10 days, with discomfort lasting about 2 to 5 days. One of the unique advantages of the laparoscopic gastric bypass is its ability to control or even reverse diabetes. So if you are a patient who suffers from diabetes, the laparoscopic gastric bypass is a very, very useful tool to get your diabetes under control. The last operation I would like to talk about is the laparoscopic duodenal switch. We can consider the switch, as we call it, to be a combination of the laparoscopic sleeve gastrectomy and the laparoscopic gastric bypass, making it the most potent and the strongest weight loss technique we have. It is obviously more complicated. There's a slightly higher risk of complication. The complication risk is less than 4%, which is quite safe. One of the complications that we worry about is malnutrition, which is not getting enough nutrients, such as macronutrients and micronutrients like vitamins and minerals, and this can be prevented by education and a very strong nutritional support. All in all, I want you to know that you have options, and I want you to know that we offer all these options at Georgia SurgiCare, and I encourage you to subscribe to our channel and call us and ask us questions. We also do offer a phone consultation, which is free, to discuss your health, your weight, and to advise you on the best way to lose weight. Thank you.